So I'm Sarah Safta. I am the head of operations for South West London Training Hub, for which Merton Training Hub is a part of. And we've been running these forums for Wandsworth and Merton for about half a year now. We think that they're doing really well. So the purpose of me kind of being here was to hear from you guys how they're going, what we could be doing next, and just to tell you a little bit more about training hubs if you haven't heard about them already. I don't know if Suzanne is on the call or not.
I don't think she is as yet.
Okay, so we'll introduce you to Suzanne, who's the training hub manager for Wandsworth. I'm going to start off with those super awkward mentee icebreaker questions, just so that I can see you and see who's in the room. Because of the way the forums are, I'm assuming, Nisha, because I don't come every time, is not everyone goes around and does introductions.
No.
Okay, so I think it's really useful. So if I tell you kind of the vision that when we thought of this concept of doing peer support forums, so with our clinical staff that we look after in Training Hub, they will often have safe spaces. The doctors have them, the nurses have them, pharmacists, paramedics. They have spaces where they're able to come together as silo professions to talk about the challenges that apply to them, to have the support around them, to know that they're not the only ones potentially experiencing what they might be experiencing, what support they might need. And over the years, we've seen that those peer support forums have really helped our practices and the individuals. Obviously, our end goal is to keep you in Merton and Wandsworth and to keep you as part of the healthcare system. I know online stuff can be really awkward, and I know cameras don't always work, etc. But for us to make this work and make it a real, what you would describe as peer support in its truest sense, it's really important to understand what the engagement from you guys is in particular. For the areas that it has worked, we eventually have done a couple of face-to-face sessions, so you're able to get into a physical room together, and it's really helped build relationships. And what's happened over the years is you develop the relationships with your peers, and you're able to turn to them for so much because their role is so similar to yours. That's absolutely never taking away from the multidisciplinary teams that general practice it now has, and they are equally important. There's no reason you can't have both together. So on that note, I've got a couple of questions. I don't know if you've got phones handy or if you've got another screen you can add. I've just got a couple of mentee questions, so I'll go through them. And then I'm just going to talk a little bit. I'll show you around actually the Training Hub website, so you kind of know from a training perspective what support you've got available for you. I'm hoping when I share my screen, this other screen will stop sharing. So I'm going to just go for it. Please ignore my diary, it's just popped up. So if you do have a phone handy, or you can add a screen on the laptop that you might be in, don't worry, this number, the mentee number, doesn't disappear. So you go to mentee.com and you enter the code 38231378. And hopefully I'll start seeing people log on. If you struggle with it, don't stress, just put stuff in the chat.
5 hours, we're going to be home.
That's a really long drive home. Put it into the chat so I can see people logging on. So if you can't log on, don't worry, just put it into the chat for me. Okay, so this is not as easy as it sounds. Thinking about what your day looks like, and you're not allowed to use more than 2 words. And I know 30 seconds on Teams feels like a lifetime, but don't worry, we can deal with the awkward silences. Sometimes I put some music on in the background, but I haven't got any today. So think about your day and no more than 2 words. Just, oh, that's 3 words. Could have done full surprises. I know what you mean though. So the more that people type the word, the bigger it gets. That's the idea behind these word clouds. Anisha, if anyone chucks stuff in the chat, let me know, so I can't see the chat while I'm doing my mentee.
Sarah, I'm unable to see any responses coming in.
I can.
Oh, my
Can other
screen
people
just
see it?
is blank.
Can other people see it? No.
No, I can see it as well, Sarah.
Okay.
And yeah, I can see it. Nisha, I can see it as well.
Oh, Maybe it's just me then. Okay.
Maybe switch camera on and off. I don't know. My answer to all technology questions is switch it on and off. Okay, blissful. Oh, I love that word. Crazy, busy, hectic, stressful, challenging, sometimes rewarding. It's a gift. That's nice.
Sorry, Zara, I think Kwan just wanted to know how to join in again. So Kwan, if you join from at menti.com and just use the code 38231378.
Yeah, it's at the top of the screen, so it'll always stay at the top of the screen. Oh, good. I've got 15 people. How many have we got on the call?
26.
So the reason I asked this question, and I do facilitation with lots of people, is you will notice that all these words you can empathize with, because they're probably applicable to everyone throughout their day. So busy often seems to be the word that's always the biggest, because that's what people feel the most. But looking at that, it's quite useful for you as a group to know that actually what you're seeing or what you're feeling is really similar to your colleagues, whether you are in whichever practice you're in, whichever borough you're in. And I can pretty much promise you that if I asked this question on a bigger forum across South West London, and it had 6 boroughs on it, it would come up with really similar stuff. And it's the questions there just to emphasize that actually all our days look like this, especially in what I would probably describe as the jungle of primary care. I don't know from the call how many of you have worked in primary care before or have been are new to primary care. If you're new to primary care, welcome. I promise you there will never be a boring day. It is chaotic and it is challenging, but the nicer words on there in terms of the reward that you get back and how it is a gift, isn't it? Oh, you can fit the whole supercala on there. Well done for trying though. Right, I've got a couple more questions. This is quite hard as well. So how do you describe your job to a 3-year-old? And I'll tell you why I asked this question in a second once you guys start answering. And Shelley, thank you for putting your camera on. It's really nice to see some faces. Otherwise, you literally, I can't tell you, as a facilitator, you feel like, try just the codes at the top. So, on the top of my screen, you can see the code 38231378. So I was saying, yeah, as a facilitator, sometimes you're looking at a screen and you don't actually know if you're speaking to anyone or just into kind of blank spaces. So thank you. I really appreciate it. A superhero. Oh, I love that. Right, listening, writing, and sending lots of letters to hospitals, helping people. I look after people. And look, that's a great way to describe it to a 3-year-old. I help look after a bunch of people in healthcare. Anything in the chat? I don't know who wrote this, but I love the superhero. It is such a wonderful way to describe it to a 3-year-old.
Nothing in the chat, Sarah.
So let me tell you why I asked this question. It's because actually when you ask this, in most healthcare professionals, whether you're a doctor, a nurse, admin, care coordinator, social prescriber, paramedic, pharmacist, whoever you might be, when I ask this question, this is what people in healthcare and primary care write, because that is the reason people do these jobs. And yes, we have the challenges, and yes, we have sometimes the things which are harder to get through, but actually trying to bring that motivation and that support back to sometimes why we do the day job that we do, it is all of these things. it's helping people, and it's so obvious when you look at this screen that that's what it's about. I'm just going to not stop sharing my screen. I need to minimize this. And what I wanted to show you, so I hope you found that helpful. And the reason I ask sometimes these questions is because of what I described. I know online can be hard, but please use it to the best. It's all these things are come from finite funding that we've got. We really think that we need it in Merton and Wandsworth. We think that it's a good thing to be giving you guys, but we need the engagement back. So I just wanted to show you the Training Hub website quickly. So it's under construction at the moment. Probably not the best time in the world to show you this, but the main stuff is on there. So it's Southwest London Training Hub.org. Put it in your browser, put it as a favorite. I wanted to, it is getting developed. By middle of October, we will see a final version. And the reason it's getting developed is the training hubs have grown faster than the website. So we always had a website for a number of years, which was a lot more simpler, and our traffic has increased, our programs have increased, and therefore we've just had to kind of go and revamp it. So the main bits I suppose I wanted to show you was that under training, when you click on the training tab, you will see we are realigning. You just click on the Southwest London one because everything applies to you guys as Southwest London colleagues. At the moment, it's coming up as quite a long list. And once the website is developed, you will see it in boxes. So it'll be a little bit easier to navigate. However, if you're looking for something specific, you can just put it in the search bar for me. So if I put in conflict, so say, for example, you wanted something on conflict management, or conflict resolution, so those two dates come up. So if the list is long, I've heard that, so the feedback we've completely heard. So we are revamping this page, so you can search for stuff, and all the stuff on the training pages is open to everyone whenever you need to book onto it. The other part is resources. And what I would really like, I suppose, with Fozia being our care coordinator forum lead, is if anyone comes across something brilliant, I would love to have a page which is resources. We can have a tab which says care coordinators, and under there we can have bits that are useful to you guys, whether it's links to other websites, because there's a lot of websites, a lot to absorb all the time. So more than happy to think about that. So if you come across stuff and you want to share it with others, send it across to Fozia or Nisha, and we can make sure we have a dedicated page for you guys. And then this list is quite long at the moment, but under events and programs, there's lots of different programs you can be having a look at. So for example, mental health training might be really useful for you guys. The non-clinical training program might be useful. We've got stuff around freedom to speak up, care navigation might be useful. It's all under development, but I just wanted to kind of show you it in real time. So I hope that's helpful. Can I quickly ask a question? Put your hands up or put it in the chat. Have you seen this website before? I'm going to stop sharing. I might get another camera on. Have people seen the website at all before? You have. Thank you, Banaz, Mariam. So hopefully that was useful. You will have save it on your thank you, Kate and Kelly. You sitting together, so you've put both. Brilliant. Oh good, I'm glad most people have seen it. You've got Nisha there as kind of our Merton lead, and Suzanne, I don't know if she's joined yet. She might not have been able to, because Suzanne has recently joined as the Wandsworth lead. She's also a practice manager in Croydon, so she does different days.
I'm here.
Oh, Suzanne, hi.
Hi, can you hear me?
Wait.
Sorry, I just
No,
joined,
that's okay.
I think, a bit more late than usual.
No, that's okay. I thought I'd get you to say hi to everyone.
Yeah, so I would just, good afternoon, everyone. My name is Suzanne. So you might have not heard my name because I'm mainly based in Croydon. I'm a practice manager in Croydon. And now I've actually taken another role on with the Training Hub, where I'm a lead at Wandsworth. So I'm sure many of you have heard of Wendy before. So I'll be working hand in hand with Wendy. And I can even put my email in this chat if you want to contact or any questions, feel free.
That would be super useful. Yeah. Thank you, Suzanne. So if you've got anything that comes up that you think we're either not covering through the forum, or actually it might be something else, feel free to contact either Nisha or Suzanne or Fawzia, and they'll be able to help you. I'm really keen to make sure that the forums, so in the background, my job is to make sure that I get funding for you guys to carry some of this stuff on. And I always need to show someone somewhere that it's working. And in order for it to work, I need people to kind of tell us it's working, join the sessions. And actually, if we're putting on a session that sounds like this is not what we need, just tell us. But no one ever, this is new, no one knows all the answers, and that's absolutely okay. So if we're going to put on, I know EMIS is really popular, but I'm just going to use EMIS as an example. If we put EMIS on and you all said, we don't actually need EMIS, just tell us you don't need it. We want to put things on for you. We want to eventually do a face-to-face. It'd be brilliant to see everyone in a room together. And I've run over by 4 minutes. I'm so sorry, but it's been an absolute pleasure to meet you. So I hope you are finding it useful. Please feedback. It's really important for us that you do, because I always need to try and secure more funding for you guys moving forward. I hope you'll find the website useful, but I'm sure today's EMIS session is going to be absolutely brilliant. So before I take up any more of their valuable time, I'm going to stop, and I'll just linger in the background if anyone's got questions. Thanks, Nisha. Thanks, Fawzia.
Thanks, Sarah.
Thanks, Sarah. I think I'm just going to hand straight over to Thomas. Is that okay at EMIS?
Yeah, Fawzia, sorry, we've got some hands up. I just wanted to check that they're okay, or did they have any questions? So we've got Bernard and then Kate and KV.
I don't know if that was in relation to Sarah's question, possibly.
Okay, they've gone down now. Okay, cool. Thank you. Over to you, Fawzia.
Thank you. I'm going to hand straight over to Thomas, if that's okay. Thomas, is that all right if I hand straight over? Brilliant.
Absolutely.
Thank you.
Hi, everyone. Nice to see you all. Thank you for the invite, Fawzia, as well. So I'm here today. Quick introduction. My name's Tom Jennings. I'm the account director here at EMIS for Southwest London, Northwest London, and Southeast London. So a considerably big patch. Keeps me on my toes. And with me today, I've brought Kathy Williams, one of our senior technical architects, to support me in the presentation that I've built for you. Now, Fawzia has sent me over a bit of an agenda about, I think she's gone around the forum and said, what do you want to know from EMIS? So we've put something together, and we're going to talk through the various topics. So we will just jump into the presentation now. Kathy will be doing most of it, as she's got a lot of technical knowledge of the system. She's been in the business for a good number of years, but there's some things that I've got specialities in. I've come from our partners team, so the data sharing, data extraction from third parties, and EMIS-X, for example. Please feel free to pop questions in the chat as they come along. I hope we'll have time for questions at the end, but feel free. I'd like it to be interactive. Jump in as and when necessary. Okay, right, I'll just share my screen. I'm going to keep it like this, just because I'm doing the presentation. Kathy's going to do a lot of talking, so if we need a pause, it'll be easier than me not being able to see everyone. Is there a question already? Did I see a hand pop up?
I think that's somebody joining the meeting.
Okay, no problem. Right then, so can you all see this?
Yeah.
Okay, so the list that Fawzia sent through, that I guess has been amalgamated from you guys, is kind of being new to EMIS Web. What are the basic hints and tips? What are the hotkeys? How do you get to where you want to be quicker? The investigations tab, got the pink box, which I'd not heard of. I called the pink box before meeting Fawzia. It's actually known as QOF, and EMIS searches. So we're gonna talk about coding. So the SNOMED codes, which have replaced historic read codes, and then EMIS codes that you'll see while you're in the EMIS system. We're going to talk about the extraction of data from third-party tools, and finally our next-gen clinical system, EMIS-X. Okay, so jumping straight in, we'll talk about basic EMIS web navigation. Now, we think, I think Kathy's got a demo system to show on her screen, so we can go through various bits and bobs and hopefully allow you all to do less clicks through the day and get to where you need to be quicker. Kathy, is that right? Are you happy to jump into this?
So I'll share my screen now, if that's okay. If you could let me know when you can see that.
That's, yeah, I can see that.
I'm wearing headphones. I don't normally wear headphones, so it's all a bit muffled, but hopefully you can hear me okay. Yeah, I'm going to minimize, Tom, so if anyone's got any questions in the chat, if you could just interrupt me, that would be brilliant.
Absolutely, yeah.
So we kind of have made an assumption about what it is you need to know as sort of new users. And I used to train on EMIS Web many moons ago, and I've had various sort of jobs since. So, you know, I kind of really like the system, and I've got used to it, and I sort of know how to navigate it. But it is practice, and it is usability that gives you that experience with the system. So basically think of it like a Windows system. So there's right clicks on your mouse, there's also menu options and various other bits, copy and paste like you would do in Word. So always try a right click if you're somewhere that you're not sure what you're trying to do, and it will give you a list of options. So first of all, it was sort of a query about hints and tips. So home screen, you can, if you're a clinician that has appointments, you can set up your appointment book for the day on your front screen. So you just use this little cog. Anywhere you see this cog, it means you can configure, and it is for you only. It's not for the organization. So those people that have an admin access and can do organizational configuration, that affects everybody. But what you do where you see cogs here, it's you're affecting just your client on your where you're working, so for your log on, so you're not, you know, affecting anybody else in the organization. So here with the config, you just click on the cog and you would choose your own name or search for your own name to find the session that you want to display on the left hand side. So for example, obviously I've got a long list of people I've already looked for, but you can sort of choose people from here and then click OK. So if I highlighted somebody, for example, and click OK, it would put my clinics in for today. I haven't got any for today, so I've chosen Dr. Emma Blue just to sort of give you a view of it. So you've got morning and afternoon clinics on display. So as you go through your day, you can see next patient, and you can call them in from here as well. So you can highlight your patient, and if you have a reception that sort of says the patient's arrived, for example, there are shortcuts on the keyboard. So I can either right click and say, change the slot status. So send patients in, quiet send in, which means if you've got a call screen, the patient's name won't come up, or patient walked out is another one. And you'll see just by the side of here, you've got letters for each of these. So actually, as you get more familiar with the system, all you need to do is highlight your patient, press S on the keyboard, and that will send the patient in, so that then can launch a consultation for you. Okay, so in your consultation screen, just while it's showing me this, I'll just show you this, what we call date, doctor, place little box that comes up on your first launch of your consultation. So if you're running a clinic, whether it be on a premise or you're going to people's houses, this is your, what we call your date, doctor, place. So you've got your date at the top, you've got your name, you've got your location that you'd normally be at, and the consultation type. So for example, if I'm seeing the patient face to face, I can say, well, actually I'm running a face-to-face clinic. Long list, face-to-face consultation. There we go. And I can store this as a default, so it won't come up again today, because I don't want to keep filling it in. So store it as my default, click OK, and then this sits at the top of your consultation screen so that you know you're seeing this patient. If halfway through the day I need to phone a patient, I can just click on this drop down here and say, actually, no, I'm doing a telephone this time. And then you can revert it back and store it as the default again for the remainder of your session. just going to cancel out of there because I want to go through that separately. So back to the home screen. So that's from your EMIS web front page. Once I've actually saved that consultation, it will mark this patient as left. So it'll cross through, so you know who you've seen and you've moved on to the next one. And if you are arriving your patients, again, just highlight, and actually the shortcut is A to arrive, and that starts the clock, shows how long the patient has been sitting waiting to come in, and then S to send in. And then when you save your consultation, the system marks it as left. Okay, so if I just go back to Rebecca for a minute, I can go into her consultation and I can mark her as left, and we'll come back to this screen. You can see that she's been crossed out. Excuse me. So going back to the sort of remainder of that screen, you've got a quick launch menu. So the menu options you use the most, just put them on here. So again, go to your little cog and go, actually, do you know what? I don't go to the planner. I don't do the appointment book. So I look at the appointment book, but I don't plan it. That's somebody else's job. So I want to get rid of that. I'm going to move that. I also don't do registrations. That's somebody else. So I'll remove that. I might want to add, what shall I add? Referrals, because that's quite useful. I do that quite a bit. When you click OK, it will just change your choice on that screen. So these are your sort of quick shortcuts to all of those parts of the system that you might want to look through. The other thing you've got on the home page is this is the updates from EMIS. And again, these will be, I'm just going to get rid of Rebecca Carr's pink box for a minute. And these will be any updates that we're sending out. And it could be something like we're updating your system this weekend. Please remember to leave your PCs on. It could be update to a professional resource with dermatology, anything like that. You can just click on those hyperlinks and it will take you through to patient.co.uk, and you'll be able to see the information in those screens. The other thing you've got on here is remote support. So that's clicking into the sort of if you've raised a case because you've got a problem with your system and you want the support person tells you to click that, that gives them access to your screen to see what you're looking at. So that's very useful. EMIS Now takes you into our knowledge base. EMIS Now, it's a place where you can raise tickets. It's a place where you can look up information. So how do I do X, Y, and Z? You can go to EMIS Now, type that in, and you'll get a list of articles that you can read. You can also sign up to the EMIS Academy free of charge, but they have courses on there, sort of ranging from a couple of minutes up to maybe half an hour, about different parts of the system and how to use them. So again, if there's something you're struggling with, it's quite a useful tool to have. You can get through it via this hyperlink, or you can get through it through EMIS Now, entirely up to you. If you're the person in your organisation that raises cases, then you can have a look at them here, and EMIS Health just takes you straight to our webpage. Okay. You've also got this option to configure your homepage, so you can do a bit of jiggery-pokery on your homepage and move things about. Just to draw your attention to this bit in faded writing at the top, if ever you are talking to our support desk, this tells you what version of EMIS you're on, okay, and that you've got Windows 11. And the last date you signed in and the last time this backed up. Now, just bear in mind, I'm on a demo system, so your backups happen automatically. This backup doesn't. So it's just because it's a demo system and it's sitting in isolation from everybody else. So that's your home page. I've got a current patient at the top here. So this is the patient précis bar. It's only because I've looked at her record already today from the appointment book. And you can open that up to see the information for that patient. You can go to Google Maps. You can look at the household information, who she's registered with, what her EMIS number is, any warnings that the patient's got. So you can manage those warnings here. You can add or take away warnings. So if you say actually they've only had one DNA, so I'm not going to worry about that, let's delete that, because any warnings you put on will pop up. And the triggers for those warnings, if I do add, you can see that these are the triggers for those warnings. So what I would advise is you don't use on swap patient. Depending what warning is, but on swap patient means every time you bring up that patient, this warning is going to pop up and you're going to have to go close, and you get sort of warning fatigue. You know, you start ignoring them. But if actually this patient needs a chaperone, you could say, when I arrive the patient, just pop this message up, needs a chaperone. I've chosen a word that I probably can't spell, chaperone, excuse my spelling. And you can add that when I arrive the patient to the appointment book, that will come up, or when I book the appointment, that will come up, probably more sensible. Click OK, and then that one comes up when I book an appointment. So very easy to manage, to edit. Don't leave them on there if they're out of date, because it's just a nuisance. Every time you look at that patient, these things keep popping up, and you'll see as we go through the screens, you know, it can be quite annoying. You can also see warnings from other organizations. So if you've got data sharing set up between yourselves and other organizations, you'll see their warnings as well. So that's quite useful if they've got maybe somebody that needs assistance, or somebody that perhaps is prone to violent outbursts, something like that. It's useful to see that if people have put them on, but you can limit that again if you want to just see yours. Okay, so that's the patient précis. I can close that up again. Then the next thing on the home page, you've got the date it last refreshed. You've got medicines management and tasks. Now these refer to workflow for those of you that use it, your workflow manager. These are messages that have come in that you need to deal with. So these are hyperlinks to take you there. The red indicates urgent, and the number is just a count. Now, just as a FYI, the task count on this front screen has a little bit of an issue at the moment where it's not showing the correct task count, but the tasks are all still there in your workflow. So you know, if you've got tasks listed, you will have to go to your workflow manager to sort them out. Don't let your tasks build up because it slows the system down. So make sure you're on top of them. Make sure that you look at your tasks and complete them and archive them so that they're done and dusted. The other quick tip on the front screen is you've got these tiny little icons at the top, and as I get older, they get smaller. I'm not quite sure what that's about. But you've got this little drop down arrow there where you can customize the quick access toolbar. So that's what this is called. So same idea as this quick launch menu in the middle here. I can choose stuff from here to put on the top here, and it becomes an icon. So for example, if I want the investigation screen, I can add it, click OK, and you'll see that I can't remember which one it is, that one. No, population reporting. You then have to go through it all till you get used to them, and you find the investigation. So that now is a quick route for me to get into the investigation screen for the current active patient that I've got on the screen. Okay. Now, the other thing you have got in EMIS is you can use keyboard shortcuts. So, for example, find a patient is F1, F5 even. So I can swap patient, and up comes my patient find. It will show me the last 10 patients I looked at. Again, that's configurable by you. But you can go in and you can search for, as it says there, all part of the name, or the date of birth, or the NHS number, or the EMIS number, or the hospital number, or part of their house name, street code, or telephone number. So all of those options are available to you when you're looking for a patient. So if I, for example, just to sort of do it, if we use the 24th of January 1984, I can pop that in if I can see 24th 011984. And it brings me up a patient that has that date of birth. Obviously, you will have more than I have on my demo system, but that patient pops up. So because she's highlighted, I can just click OK, or I can double click on the patient, and it swaps my précis bar to that patient. So I'm now looking at a different patient. So whatever patient you've got on the top of your screen, if I now go into anything on here, it will refer to that patient, unless it's, so workflow manager, appointment book, and population reporting aren't patient specific. So these under the care record will take me straight to Caitlin Preston. The other thing you've got on your homepage, didn't realise this was going to take me so long really, is the ball. Now, the EMIS ball shows all. If you remember that, that will show you everything you have access to. So if there's something you can't do and you need to do, and you think, well, I can't find it anywhere, I've tried all of this, the EMIS ball will show you all the modules that you've been given access to. So it might be that you need a different RBAC code on your smart card. So in which case, you know, to get into certain parts of the system, it's run by the RBACs on your smart card. So you need to talk to your system admin and say, you know, what is it I need to get into the appointment planner, for example, which is where the appointment book is built. But this shows you everything that you've got access to, okay, including the audit trail if you're, you know, if you're that level, you've got that level of access. You can get in the system tools, you can get into the audit trail. I haven't actually added it on this one, but that's where it's found, okay. So system ball shows all. I can go in that way. I can use my icons, or I can use my quick launch menu. Okay, so the next thing, Tom, can you just remind me what the next thing on the list was on that one?
Yeah, absolutely. 1 second. So
Privacy, was it?
yeah, so we in this ball toolbar homepage privacy mode.
Okay, privacy mode. So there was a query about privacy mode, and the only place you've really got it, so apart from always remembering to sit with your screen facing away from your patient and other people and locking your screen when you leave it, in the appointment book, if you're looking for an appointment for your patient and they're there with you, you've got this privacy option on your patient and on your appointment book. And if I press that, these all just change to numbers. So the patient can't see who else is booked in for the appointments today. Okay, that's just literally a toggle on and off. So you can put the names back on when you're ready. You've also got the option in the appointment book to look at AM and PM only. So if you've got a very busy appointment book, you can actually sort of go, right, let's just look at this morning's clinics, see what was going on, or let's look at this afternoon's clinics. Now, from an EMIS point of view, the afternoon starts at 12. Okay, just so you've got that in your head. Sorry, excuse me, sniffing. And you've also got, let's just go back to the home page. So you've also got on each of the modules that I go into, you'll have a toolbar across the top. So if I'm just going to change my patient back to Rebecca because she's got a lot of data. If I then have Rebecca at the top of the screen and I want to go to her summary in her care record, EMIS system is set up that each patient has this care record. So it's always the same. Obviously, you add the data into their care record, but when you look at a patient's care record, you've got these options across the top. So everywhere we go, they'll be slightly different, but these are menu options for the tab that you have open, okay? But the patient record consists of other modules that you can go into. So this is a summary for this patient. You can alter the summary page. You've got a config option here. So if you specifically deal with just dermatology, all right, you're not really interested in all our other problems, just dermatology, you can actually sort of set up your style, your text, your clinical view. So clinical view will sort of say, you know, what actually do I want to see? Well, I'd quite like to see just the diabetic view actually, because that's what I deal with. You can swap it and click OK. You can also make your own. And then the system sort of gives you, if she hasn't got any, but this lady has, the diabetic view for this patient. So anything that would be relevant, like investigations, problems that have been put on medicine, etc., will display on the patient summary screen. And you can set that as a default for you personally. So have a play with the config. If you get a bit lost and it all gets a bit confusing, hitting the summary screen will bring you back to the sort of reset, if you like, so that you know you've got it. But you can set your summary screen as a default so that you're always looking at X, Y, and Z. In every screen along the top here, every module along the top here, you've always got the add button. Okay, so you've got the option to add any of these at any point without having a consultation with the patient. Okay, so just again, just click on the drop down, see what it says, and any of those you can add. So just to go along across the top, so the next screen I've got for this particular patient is consultations. Okay, So I'm looking at my record for consultations. I have a date navigator, so I can skip down to 1st of January, you know, or go back to 2020 and have a look, see what they got in there. I can also add a consultation here. So in my drop down, I've got all these things I can add. I can also add any of these. I can edit a consultation. So if I've highlighted a consultation, I get the option to edit. And because of my access right, I can delete, but some people obviously wouldn't have that. Okay. I can look at just my consultations. So the ones that I've put on the system. I don't want to see everybody's, I just want to see mine. If you click on that, it just shows you your consultations. Oh, excuse me. You've also got filters, so you can, if you click on manage, you can build yourself a filter. So on these that are already set up, I can say, just show me where the GP's seen them, please, or just show me where the nurse has seen them. But you can build your own, which is quite useful. So again, if you specialize in something, click on manage, you get a little box come up, you do add, and then you sort of decide what it is you want to do, okay, and fill all these in, and Bob's your uncle, you've got a filter. Very useful if you're sort of doing a specialty, sorry. Just to be aware of, in the patient's record, if you share with other organisations, you can see just your record, which is what I'm looking at now, or you can see all records. So all records, if they've got this little funny blue and red symbol next to it, which, yeah, I'm not keen. I don't really know what that is. I think it's 2 arrows. I can't really see. That means this data has been entered somewhere else. Okay, so you can see what it was, where that it was entered, and who by. So you can see that your patient has been perhaps to a hub to have some additional assessment or treatment, and you can see all of that information here. Sometimes this gets a little bit cluttered and you actually just want to see your record and what you've done with the patient, but you've got that option in all of these screens across the patient record. Okay, so medication, you've got a medication screen again, just see your record, or you can see all records where patients have been prescribed something outside of your organisation. And again, you've got all these options across the top that you can do, including a configure. You can view current and past drugs. You can group drugs. So what I suggest you do, if you haven't really looked at this before, if you're not adding a drug, actually, if you're just sort of looking at the options you've got, you know, have a go at grouping, see what that looks like. You can group by the EMIS drug groups, which is the BNF. You can group by problems. So none of these drugs have been linked specifically to a problem, so that's why they're unlinked. You can view acute and repeat. Excuse me, I'm going to cough. Beg your pardon. Sorry. Or acute and repeat, and here you've got the drug and you've got the issue date and who issued it. Sorry, excuse me a minute, Tom. Not used to talking so much. So again, have a look at your medication screen. You've then got your problem screen. I'm just going to grab a glass of water. I do apologise.
No problem. So while Kathy's away, I can see we've had one question from Sawa about the showing how to set up a GP only filter. I'll certainly bring that up when Kathy gets back. Is there anything else that anyone would like to see in particular whilst we've got a minute?
Guys, I heard the GP filter. Well, is that on the appointment book? I can't remember where I was looking there.
So the question, yeah. So the question says, can you show us how to set up the GP only filter, please? Do you need more detail on that?
No, that's fine. Thank you. Yeah, we can do that. next tab is the problem tab. So this actually just pulls all the problems that the patients had added, whether they're active or past problems, and you have significant or minor problems. So if it's something like persistent cough, which is what I've got, it's a minor past problem, and so after 6 weeks it moved into past problems. You don't have to move it. If you've got active significant problems, they stay on the patient's active record because they're sort of chronic as opposed to acute. Again, you've got all these options across the top. Haven't really got time to go into them all today, but if you look at the EMIS now and you say, right, I'm in problem page, it will go through all of these and how to do all of this information. If you've got a huge record, you've got text search, you've also got your filters again, so you can design a filter, and you've got your text search there, so you can just search by, let's pop in, let's just pop in cough, for example. So what it does is filter the record on cough, and you'll get all the problems listed where cough has been present, and you can just take that off using the cross on the right hand side. So the next screen is investigations, and there was a sort of query about could we look at investigations. We certainly can, and again, you've got my record or you've got all records where investigations might have been requested elsewhere. I'm just going to minimize that again. So you've got your investigations, and as you move down them, you'll see the right hand side detailed view changes to the one that I've got highlighted. Okay. You've also got along the top here in your sort of menu options, again, you've got your filter and text search if you want. You've got a trend, so you can see a graphical trend. So what that will look at is not just that latest result, but any previous results you've had for that patient. And you can see it in a graphical format. So it's very useful if you're talking to a patient to be able to show them, you know, this is how you're doing with weight loss or blood pressure or whatever it might be, and you can actually print that out and give it to them if you want to. The tabular box just changes it all to a list of dates and results, but the graphical one just makes it easier when you're sort of explaining to the patient. Okay, so that is in that trend box at the top there. Click on the drop down. So again, I would just encourage you to look at these buttons and have a press and see what they do. If you're not adding data, you can't break it. It just sort of takes you to different places and you think, oh, right, okay, you know, let's have a look at that. You've just got a breakdown here, and anywhere you see a cross on the left hand side, it means you can open it up and see who's been seeing the patients. In this case, it was district nursing. Okay. So again, have a look at what you've got. Values view is the view that we're on. It's sort of showing us the values of all the previous tests that have been done for the patient. Okay. Care history. This tab is very useful if there's something you can't find, because it lists everything that's been entered on your system for the patient in a chronological order. And you've got, again, your text search. So, for example, if I want to see their smoking status, I could key in smoking. Oh, nothing's come up. Right, fine. Let's try another one. I thought I saw smoking. Obviously not. So let's try pain, just see what comes up. And then it will show me all the entries that have pain as part of that entry. So you can, you know, have a look at those particular entries. If a patient presents with something, you can just, rather than trying to wade through all those dates, you can just enter that keyword and up they'll pop. So you can sort of say, oh yeah, you've presented before and we've done your fit note and what have you, you know. That will, I mean, I don't know if you noticed there, it brought up a no pain one as well. So pain in itself is a code, but it's a negative and positive code. So if I just type in pain, it will come up with no pain or pain. So you've got both of those options there. Also in the care history, you've got some shortcuts, if you like. So I can see what they call health status. So these would be the things you would expect when you're looking at a patient having a sort of health check. Family history for the patient. So they've got family history of asthma, any immunizations they've had. So this will sort of be all their COVID stuff, their flu, their shingles, you know, whatever it might be, will all be under immunizations. Then we can look at their allergies, if they've got any allergies. And then we can come back to all data, which is what we were looking at, or what's called non-value data. So that just takes out all the investigations and leaves you with all the sort of non-value data. I don't know many people that use that one, to be fair. So that's your care history. Sorry, I'm losing the top of the screen now. Here we go. Next one is diary. I can click on it. There we go. So this shows any appointments the patient's got. It also shows any what's called a recall. So you can set up recalls for your patient to come in for annual reviews or etc. etc. And for this one, for example, the seasonal flu vaccination, if I run the template, it will bring me up an immunisation template to complete for the patient. Just means they presented and I'm going to fill it in. Normally they wouldn't all be out of date like this, obviously, but it's just for a demonstration purposes. And then the next tab that you can't quite see is documents. I don't know if you can see it. I've got the stop sharing option right in the way. Let me just minimize my screen slightly. There we go. One way of doing it. So this is all the patient's documents that have been attached to the patient record. So you can see a list of patient documents, rather, sorry. If you're looking for something specific, you're not quite sure what it's called. If you use this explore document or explore attachment option, you can just run through. Oh, right, that's a fit. No, that's not what I want. This is their red risk admission. This took a while to load actually because it was quite big, I think. But you can just flick through all the documents rather than just sort of wading through them all and opening and closing them. You can just say, oh no, that's not what I want, or it's that one. So you can just move through them. It just makes life a bit easier. You've got your export option, so you can export any of the documents. You've got edit, delete, etc. And then the final one, sorry, final two is we've got the referral screen, which you possibly use quite a bit. So let's go to all records. These are the referrals that have happened for this patient. So where they've been referred and what date they've been referred. And then the last one is what we call care plans. This is a fairly new one, but you can actually create care plans for your patients if you need to. Happens sort of a lot in the community. So if I'm just looking at all records here, I can see there's already a care plan set up for the mobility of this patient. You can click on it, and if you say, actually it's not mine, so I can't open it, sorry. If it's one that I've created, I can click on it and open it. You can actually share them, but that one's not been specifically set up to be shared. So that in summary is the patient record. I think it was the consultation one with the filter, wasn't it? So GP only. Okay, so that's easy as that. The filter, I filtered it on GP only, so the only consultations I'll be looking at are GPs or associate practitioners. Okay, if I want to take that filter off, I just click on the right hand side. So it's as easy as that. Those preset filters are as easy as that to sort of turn on and off. Okay.
Thanks, Kathy. We've actually got a couple more questions in the chat at the moment. So Fawzi has asked, for blood tests in the investigations tab, is there a shortcut to copying results from Cerner?
So Cerner should feed in to EMIS.
Yeah.
Oh, right. If they've been taken, if the test has been sampled and taken in the hospital, so it's not on your system, is what, it's not a test you've done, I think, is probably what we mean. You have to go into the portal and have a look.
Yeah, that's correct, Kathy. Yeah. If it's in the portal, is there any way, is it like a quick shortcut at all?
Not really, not to copy and paste because it's not been done by your organisation. It is possible. No, you can. No, I was sorry. I'm just thinking on the spot here. No, it's not possible because you've got the portal. So you see the hospital results in the portal. I was thinking of sharing, but if you can see them anyway, that's done and dusted. So there's no point.
I think the issue is, you see, often more than not, you end up having to open up the portal and then copy those results by running a template then in EMIS. and then obviously then filling those particular tests in.
Right. Okay. So do you know which path lab is being used?
So it'll be South West London pathology.
So is that, Tom, is that TDL?
That's going to be St George's.
St George's. Okay. I don't know if there's any way of doing it. I know in London they have something called TDL, which runs the investigations. I think it's across London. I just need to find out who your path lab is, because there is a possibility of copying the result back to the GP's registered record, or the patient's registered record, sorry, at the GP practice. So can you leave that with us? And Tom, if you wouldn't mind just making a quick note, it's St George's. We'll see what we can do for you.
Brilliant, thank you.
Okay, you're welcome. Is there another question?
Yes, there is. How can the forum be shown how to use how to set up a recall as it is in the diary tab?
We won't have time today. I can send you some information from EMIS now, which will explain how to do it. And I think probably we've got like an hour free training sessions that we could book you into to do that very thing. If it's what, you know, can you show me how to do this? Because it's not a simple 2-minute thing, you know, it's a bit more complicated than that. So if you're okay with that, we'll send you the written information, and then if you'd like to book in for a free training session for an hour, somebody will help you set them up and explain to you what it's all about, if that's okay. Okay. Just while we're on this screen, the pink box, okay, this is your QOF, but it's also if your organization create a protocol, for example, they can say, right, every time you look at this patient, I want the system to run a check and see if they've had their blood pressure reading done this year. And if they haven't, put it in the pink box along with all the QOF stuff. Okay, so the pink box is all the stuff that the patient needs. So it's dependent on, you know, what problem codes they have. It's dependent on what QOF their sort of registers they're on as to what will appear in this box. Now, a really good hint with this box is if you think, oh, I better fill that in, you know, damn it, I've got to do seasonal flu vac, you know, I've got to find the template and everything. If you go to this little lightning bolt here and press it, what system does is create a template to fill in all those QOF things, all those little things in the pink box. Okay, so you've got the template up for flu, so you can say, okay, they declined seasonal flu, and then I've got another screen here, if you like, for the next thing on there is the meningitis. So they've had their first meningitis, shall we say. And then if you click on save, that will save into the patient's record. And the system has updated that pink box in real time, if you see that. And we've just gone back to patient eligible for the LCD referral. So it's a really quick way of filling in stuff that you need, particularly if your organisation needs to claim you know, the funding for those sort of things. It's a really quick way of doing it, but it also keeps the patient's record up to date with all their annual reviews and everything that they need doing. So while you've got the patient in front of you, if there's anything on that pink box you can sort, then please do. You can get rid of it. So this little drop down arrow at the side just puts it out the way, but it puts it here where you've got alerts with that exclamation mark. That will just bring it back up again. Okay. I'm just going to go back to the home page. I think the next thing was population reporting or searching. And there's SNOMED codes, Tom. I'm just trying to remember what's on the list. Let's just do the SNOMED codes first. Are we all right for time?
Yeah, I think we're going to run out quite quickly, which is, you know, I think we expected this with the number of topics, but we'll, you know, we can pick that one up after.
Okay.
So well, sorry, Kathy, did you say you're going to move on? Did you say you're going to move on to the coding section?
I was just going to discuss the coding.
Yeah. So we got
okay?
we got SNOMED, read and EMIS codes, and we're just going to give a brief explanation, and then SNOMED versus EMIS codes, because obviously SNOMED replaced READ some time ago.
Yeah. So if I just look at a patient's care history, just to, actually, if I go into their consultations, that's probably clearer. So in a patient's record, all of their data that is recorded using a code can be searched on. Okay, so you can't search on just free text. So you need to get used to using coding to sort of add information to the patient's record. So if I add a consultation, just to show you, I'm going to search for a problem. It first of all gives me the 3 SNOMED codes for that problem. Now, the reason why it's now SNOMED CT codes is because nationally we've all moved away from READ coding. So READ coding is the old version of coding, and SNOMED coding is the new, everybody's got to use it coding. Now, I think, as far as I remember, eventually this will also go into the acute, because they use the CT coding at the moment. But so that's the reason behind it, is then when you're data sharing, coding becomes a lot simpler because it's all standardized, and you can, oh yeah, that's what I would put. I know what that means. That's a code I would use. So basically, when you're looking at coding, when you go into the system, your F4 key will bring up the code selector. Okay, or I can start typing. I'm going to enter a problem code, so I'm going to just go with cough because it's useful. And all these things that it's giving me are coded in the background. Okay, if I just ignored it and went, I'm going to type this in, I can do that. The system will let me, but now I can't search on that because it's not a code. Okay, but what I can do is say, this patient's got a cough, and I can choose the top one. So, yep, they got a cough. Okay, I can pop in a severity, so we'll say moderately and it's frequent. Okay, and then when I've done that, it puts in the code for me. It puts in, I've chosen its moderate severity and frequent. You've got all these little boxes underneath, so you can change any of that if you want to. I can then free text after that. So if I run a search on coughs, I can also say, show me associated free text with those problem codes. So I get the free text coming up as well. Okay. And that's the reason behind the SNOMED coding, is that you need to standardize coding, and as much as possible when you're doing, so like even if I'm doing examination and say chest, start typing it in, and you can then on examination, chest x-ray normal, acute. So you can start to sort of look for codes, and you can see at the bottom there, well, I can scroll down so I can see all of it, but open the code selector is either a hyperlink or you can press F4. So I can just click on that and that box comes up again. And this is where I can see codes, SNOMED CT code, I can see what it is, the EMIS code. Now, the EMIS codes are historical. You shouldn't use them anymore, but what it's saying is there was an EMIS code relating to chest, cough, pain or whatever. It would no longer be in use, but we can't delete them because historically they're sitting in the patient's record, if that makes sense. Any code that we had that we could match across, we did when SNOMED came in, but there are some EMIS codes that we can't match across. And that's why you'll see both in the record, but you'll always be offered the SNOMED CT coding, and that's what you can do. So across the top here, you've got your code options. So you've got it's a disorder, or it's an observation, or it's a procedure. So any of those you can put in. Actually, I'm going to include family history, nothing on there, allergies or referrals or admin. So I'm going to say, it's a disorder and it's a lower respiratory tract infection, etc. Okay, that's thrown up a little prompt to say, do you want to use either of these templates to help me put in information? And obviously that's part of your system setup, that you can add those yourself to say, if somebody says it's X, then bring up these templates to allow them to fill in more data. Okay, so does that help with the coding? I hope that's clear for everybody with the coding. Is there anything else, Tom, I need to cover?
So we've gone through the basic EMIS web navigation, investigations tab, the QOF, EMIS searches. Have we?
Well, just very quickly then, because again,
Yeah.
this is one that needs a proper training session for you guys. But what I thought I'd just show you is when you go into your reporting, and you'll see that I did that for my EMIS ball. I just went to reporting and chose population reporting, or you can just hit reporting. It brings you to the same screen. You have some searches that you would have set up, so you can see people's names against this. These are all EMIS people saying, I've set up a search, don't touch it, it's my folder. So you get your sort of own organizational searches that people have set up. You will also get your GP QOF searches. So these are the searches that we input into the system once we've got them from NHS Digital or NHS England. So these are the bits that sort of do your funding. So they are registers, for example, and you can, again, this won't work in my demo system, but when you look at it and click on a search, it will tell you what the search is looking for. It will tell you how many patients are in that search. It will tell you how near your target you are, how many points that is, and when it last run. You can force a run. You can right click on it and ask it to run so that it's up to date. But again, because we can't run QOF in here, I can't do it. But you can run the searches and make sure they're up to date. You can also copy a QOF search into your own folders. So you'll see that there's a copy option. So you can copy it, obviously give it a slightly different name, otherwise you will be affecting the QOF searches, it won't let you save it. And then you can save it into your organization folders. So these folders work very similar to Microsoft Word. You know, you've got a folder there, there's mine, and I can add things to my folder. Now, we don't have time today to show you how to add a search because it's quite complicated until you get your head around it. So again, that would be a good one for a training session, free 1 hour training session. You've also got in the searches the EMIS library. So again, these are searches that we put in the system just to help you really. So these are ones, you know, that you might want to run or copy and then edit so that they're more applicable to your own organizations. Okay. Anything else, Tom?
So we have a couple of questions in the chat. When is the latest backup EMIS web date and year should play? Now, obviously, as you said earlier, you're on a test system, so your backup is showing as nearly a couple of years ago. But is it a daily basis that the live systems?
The live systems are backed up as you type, basically. So as long as you've saved your information, it has been backed up. So if I go into a consultation and I'm typing away and I don't save it and my system crashes, you know, like any IT stuff, it's not going to save and I'll have to do it again. But if I've gone in, put in my information and press saved, that information is saved and will be backed up. Okay, so we do it sort of like almost constantly. There's a backup to our local servers, and then it's saved in Amazon Web Services, only in the UK, of course, but that gives us the sort of future proofing and agility to increase our databases as we need to. Okay.
Thank you.
EMIS-X, do you want me to go into EMIS-X?
So it's just one final question, and then we can move on to well, if I do the third-party data extraction, and then we can kind of dual work on EMIS-X. So does coding have to be put in consultations, or can it just go to problems?
If you're seeing the patient, you really need to add it as a consultation because that's your sort of face-to-face stuff. Yeah. You can in here add a clinical note, there we go, for your patient, but you can go straight to problems and add it. But if you go straight to problems and add it, all you're adding is a problem code. You're not adding any explanation around that, or so I'm just basically saying the patient's got this, but I'm not saying I've examined them or I've looked into their family history or I've given them medication or anything like that. So if they've if you're doing a summary of a patient record that's just come to you, for example, yeah, by all means, you can add it in, but I would recommend most of the time you do it via consultation. Okay, so if I wanted to add it here, you just click on the green across, search for your code. So hyper. Oh. Let's go with essential hypertension. Double click on it. You can see it's a QOF code. I can put in descriptive text, so I can add some text. Do I want to display it to patient care record online? Probably. But obviously that's an option that you can say no, you don't, and record it as a problem. So is it active, significant, first episode, and remains active indefinitely because it's a major, obviously it's a major problem. The system works that out because it looks through the patient's record and says you haven't put this on before, therefore it's a new problem for the patient. So the system says this is active, this is significant because that code is chronic. It's the first time we've seen it, so therefore it remains in their problem list. And you can add another there. So I think the summarizers might use that, but essentially I would possibly not add it as a consultation. But I think if you're doing medication, certainly if you're in front of the patient, definitely use consultations. But if you're not, yeah, then absolutely fine.
Okay. Yeah, that's it for the questions by the looks of it. So if we just move on to the extraction of data by third parties, such as Ardens, for example, I'll give you a bit of background from the partner program that I used to work in EMIS. So we put all of our partners through a fairly rigorous assurance piece. So when they initially get in touch with us, we have a scoping call with them. We understand more about them, who they are, what they do, what they want to achieve via an integration with EMIS. And we have around 4 off-the-shelf interfaces that they can link into. So you've got things like Partner API, Portal SDK, extracts, and then you've got the MIG. So that's the Medical Interoperability Gateway. That was actually Healthcare Gateway's product before we acquired them. So with extracts, obviously some organizations want to just get a pull of data from a practice so that they can put it into a nice fancy dashboard and then present it back in a prettier way rather than having to pull it out the system into a CSV file and try and present it to maybe a not so technical person. So when organizations come to us and they say, yeah, we need access to your extract system, it has to be in line, in an agreement with the organizations they want to pull data from. So moving on to kind of data sharing agreements, we actually have that set up in the background once a partner has become assured, and we say, right, X, Y, and Z practices, this organization wants to connect to you. Are you okay with this? They have to actually accept it within their actual EMIS web instance. So no data will start flowing until this acceptance has been given by the practice as the data controller. And we also mandate, that the organizations that partner with us, they go through a reassurance every couple of years, just because we've seen in the past that when some organizations have maybe bought their proof of concept through the assurance program, they've built on it and we're not aware of the enhanced functionality. So we do mandate that they go through the assurance program every couple of years, just to make sure that we've got a clear view of what they're doing at any one point. Now, there is another mechanism of going through assurance, and that's through NHS England. It's called the IM1 pairing program. Now, it's a very similar process. It's actually sponsored by NHS England, so the third party in question will not pay out of their own pocket to become assured. However, it does take a considerably longer length of time. I couldn't put a specific timeline on it, but we're talking kind of into the 6 to 9 months area rather than maybe 6 to 12 weeks. And similarly, there are limitations. So, for example, with extracts, we can only pull data from GP practices, so EMIS-Web GP, rather than any community or clinical services organisations. And IM1 only focusing on England as well, so you wouldn't ever be able to look into Scotland or other areas of the UK. Is there any specific questions on data sharing and third parties kind of tapping into the EMIS data? Can't see anything in the chat, so I'll move on to EMIS-X. Kathy, if I just kind of give a background on it and its features, and then if the demo system is working, then please feel free to load that one up. So the history to EMIS-X is obviously, EMIS has been around for a long time. We're probably talking, I think it was EMIS-Web kind of came into play around 1985, so we're talking 30 to 40 years now that it's been in play. It's grown and grown, and we've added more and more things to it. So at first we serviced primary care, then we branched out and gave an offering to community. We've got Symphony, which is the accident and emergency offering, and we're also in pharmacy, so with our ProScript Connect offering. As I'm sure you're aware, it's grown, it's got bigger and bigger. We've pumped everything into it, and there's not so much a limitation, but as with anything, technology grows, new technology comes out, and we feel that now is the optimal time to start offering our next gen system known as EMIS-X. So some of the capabilities that EMIS-X has at the moment, you've got instant messaging that replaces screen messaging in EMIS-Web. Some of you may well be more experienced EMIS-Web users than others. Screen messaging was a bit of a nightmare. It was very temperamental. You'd never know if your message sent. There was no audit trail. It was online, offline. Probably about the same amount of time for the week. So instant messaging has replaced all of that. Instant messaging has got enhancements. There's a full audit trail. You can have group messages. You can set messages to kind of repeatedly notify the recipient. So if it's a particularly urgent message, you can say, look, I really need help with this. Obviously, it's not intended to be used as a clinical tool, so clinical questions shouldn't be passed across it, but it is a much better platform to use for messaging colleagues. And we're also extending it in the near future to work cross organisation. So rather than just being limited to your own practice, where there's a PCN in question, as we start to roll out the companion app to those types of orgs, which is looking like it's going to be October, we will allow people to message outside of their immediate organisation. There's also clinical views, which is kind of the main focus at the moment. So as you load up, Kathy will be able to show you in a minute, but as you load up EMIS-Web on a morning, EMIS-X will automatically pop up in the right hand side, the companion app, and it will follow you around what you're doing in EMIS-Web. So if you're accessing John Smith, then EMIS-X will also present John Smith. You will have, and in the clinical views, you will be able to see the latest, the medication, the problems, the allergies, etc. there, ready to see in your right hand side of your screen, rather than having to kind of pop in and out of the record of EMIS-Web, which users have historically had to do. That it's just all there in one place. You can also see letters and templates. It's much quicker. We're getting a lot of feedback that EMIS-X is a lot faster than EMIS-Web, and so that's good, because I think speed is something that EMIS-Web is known to need improvement on. And what else have we got? So we've recently put Recruit into there, EMIS Recruit. Now that's the technology that identifies patients that are eligible for certain clinical trials. So we've pushed EMIS Recruit into EMIS Academy, into EMIS-X, sorry, in the hope that it gets more kind of, people see it more, and they want to, and they look into it and want to use it. What else have we got? We've got, I think you can probably see from Kathy's scrolling, we've got easy links to it, EMIS Now, so single sign on to EMIS Now. You can just click straight out of EMIS-X rather than having to log on and use another set of credentials. And then you've got EMIS Academy there, both of which I have presented to Fawzia and said, look, these are going to be really key for this forum to enhance and expand their knowledge on the system. And the future capabilities, we are really focusing on browser-based access for EMIS-X at the moment. So instead of having to log on to EMIS in the morning, usual way of finding the EMIS web icon application on your desktop and double-clicking it, then signing in the usual way. EMIS-X browser-based will actually allow you to just go into Chrome, Firefox, whatever you use, pop in a URL, and away you go. It will verify your identity in the usual way, so smart cards in most people's cases, and then you'll be able to use elements of EMIS-X as a browser-based function. Now, as I'm sure a lot of you know, we are modularly releasing EMIS-X. We're doing kind of monthly releases, so more and more functionality is coming all the time, but it is intended to be used in tandem with EMIS Web until until we see users kind of using more of EMIS Web and less of more of EMIS-X, sorry, and less of EMIS Web, at which point, 2026 maybe, we're going to start sunsetting EMIS Web completely, but we won't do that until we're confident that everything that is in there now is into EMIS-X. So Kathy, do you want to maybe give a bit of a whistle-stop tour of EMIS-X? We've got about 6 minutes left.
Yeah, I think you've done a great job there, Tom. Thank you. Don't think I need to. EMIS-X will launch with your main EMIS web and sit at the bottom here on your toolbar. You can also click on here to launch it. So as Tom explained, really, you've got a menu option at the side here, which tells you you can go into the patient's record. That's quite useful if you're doing, say you want to look at medication while you're consulting with the patient and you're sort of doing their consultation. You can have a look at their medication whilst you're doing that, and you've got the consultation page open behind. You've got these search options. You've also got this messaging, as Tom mentioned. So if I sort of go back to the home screen, I'm alerted that I've got a message on here. So you can send messages, as Tom said, it's much more reliable than the screen messaging to your colleagues, and use this functionality to do that. You've got the EMIS. If I click on the EMIS-X option, that's your sort of home page, as Tom explained. There's a video there on how to use it, so you don't even have to go out of here to work that out. And the little menu option at the side allows me to either message, look at population. That's something slightly different. The resources, I can go in there and have a look at EMIS Now rather than linking from the home page. And I can also do selected patient, which means whichever patient I've got active in the EMIS web system, I can then click on and look at their medical record. Okay, so very easy to use, very straightforward. And if you want to know more about it, I would suggest you open it up, click on the demo, have a little watch, but it's no more complicated than what we've just shown you. So there we go.
And I think a final thing to say about EMIS-X, the companion app, is we have had confirmation that you can copy and paste from X into web. So historically, I think it's been slightly difficult to do copy and pasting within EMIS Web itself, but that's one thing that was kind of asked time and time again, and we had confirmation from our product team that yeah, it's available. So it's quite useful if you're using something from the companion app, maybe a medication history or the medication they're on at the moment, and you need to pop something into a consultation in web. Okay, so we've fit quite a lot into the hour. I hope that was sufficient for everyone. I will share the presentation with Fawzia afterwards, so she can kind of move that around to you all. Is there any other questions while you've still got us? Did you think the session was beneficial? I just want to double check. Actually, I did take down some notes on the questions. So we've got the recall question for Theophilus. We're going to sort out an expert connect session from that, and I believe you're from CDB 1582. The Southwest London Path Labs question from Fawzia. Can we just go into that a bit more detail? I don't want to come off the call and then Kathy say, what was that about? And I haven't quite got the right information. So Fawzia, could you come back in on that, please?
Yeah, no, Tom, I can. I'm happy to kind of share the information with you at a later time, if that's okay.
Okay. Yep.
Yeah,
Perfect.
that's
Yeah.
not a problem. I can relay that to yourself. That's not a problem. Thank you.
And then I think there was a question about the searches, wasn't there? As Kathy gave you kind of a brief overview, but again, that's more for an expert connect free of charge 1 hour session with one of our trainers to go through it in more detail. That is, yep. So I think that's about it then. Fawzia, any questions? Any feedback?
No, it's been a fantastic session. Thank you both to yourself and Kathy. I mean, brilliant overview of EMIS. I think we will definitely have to take advantage of those training sessions though. So as and when, you know, people come back to us, then we'll certainly come to yourselves and try and organise some training sessions if that's okay.
Yeah, absolutely. You know, as we've discussed before, Expert Connect is readily available. We were doing a pilot with Southwest London actually recently, and it's good to see that a lot of people on here have got practice names linked to their accounts and email addresses, because we are focusing on more on primary care, so that's good. As we've discussed before, and I know Zara said at the start about funding, we can give you paid. But you know, you can purchase paid training sessions, which is around 6.5 to 7 hours a day with one of our transformation specialists. So you can really get you know, a lot out of that if there is a group of people that need particular training on any subjects. But yeah, you know, we can talk about that later down the line.
No, appreciate that. Thank you so much, Tom. Appreciate it.
Right, no problem then. Oh, hang on a sec. I've seen one more thing come up. Would it be possible to have EMIS X tab for services signposting for Wandsworth? EMIS X tab. Sorry, Sawa, do you want to maybe expand on that? If we may be at time now, people may want to drop off. I mean, I'll pop my email address in here if you want to pick up with me afterwards. There you go. Right, that's in then. Okay, I think we'll call it there. And then, you know, any questions that need to come through afterwards, you've got my email address. Feel free to reach out.
Brilliant. Thank you so much. I was just going to ask if everyone could possibly stay on just so that we can complete a Menti poll. I do realise that we've run out of time somewhat, but it would be really beneficial for us just to get some feedback from the session and also for future sessions as well. So just a request if everyone could just stay on. Thank you.
Kathy and I will jump then. Thank you all.
Brilliant. Thank you so much, Tom. Thank you so much,
Cheers.
Kathy.
Bye-bye.
Amazing. Thank you.
Fawzia, can you see my screen?
I can. Yes.
Okay.
I can.
Cool. Okay. Thanks, guys. I know it's 1:30, but we just really would like to get your feedback on today's session. So if you just jump back onto Menti, we've got a different code to Zara's because it's another Menti. If you could please just log on. The code is 67280828. Just whilst everyone's logging on, I don't know if you received an email from me. It was a while ago. So Peak Consulting are a trading provider, and they are providing a care coordinator conference completely free of charge in November. I will send out the comms again when I send the recording. So I'd encourage you guys to sign up and attend. I'm sure it will be really valuable. Okay, I've only got one person logged on to Menti. You can even scan this QR code on your smartphone and you'll be able to get in as well.
I think Katie's asking what the code is. So it's 67280828. I'll write it in the chat as well.
Yeah, I think there was just lots of information and we definitely need to get them back for another session. I think EMIS is really wide and There's just lots of elements to it.
Yeah, I mean, and those were only certain areas as well that they covered, so which I thought were relevant to the care coordinator role. So there is so much in terms of the topics, but I'll try and kind of narrow them down and possibly organize some kind of training sessions as well. So that is on the books as well.
Okay, we've got one person who said that they didn't find the session useful. That's completely okay. If you are able to send me or Fozia or both of us an email and just say what elements of EMIS would you like to learn about for future sessions, that will help us to tailor it for next time.
So yeah, is everybody confident with using EMIS Web in your role as a care coordinator? So obviously this does depend on how long you've been in the role and obviously your previous experience with EMIS and obviously your role as a care coordinator. Tejas, if you can't log into Menti, if you just want to put your answers in the chat and then we can certainly add those in too, not a problem. So did you actually receive any formal training on EMIS as part of your induction? This is quite an interesting one. Okay, I'm just interested to know actually, in terms of those who have said yes to formal training, is that because an instructor from EMIS came to the actual practice and went through? Okay. So I think we've already answered this question in terms of additional training. I think we do need to kind of select the topic and possibly have training on that particular topic rather than an overview. Yeah, so Tejas is saying as well, another session, more training on EMIS. Yeah, as part of your CPD, has anyone actually signed up to using EMIS Now, EMIS Academy? So I think they touched on it in the actual presentation. So I think formally we had the EMIS Now, so that's just kind of articles on the various kind of topics in EMIS itself, but EMIS Academy is part of training, I think. So you can actually go through courses and you'll get certificates at the end. Okay, so maybe that's something that we can obviously go through as well. And it is actually free to sign up. So this is now our 6th Care Coordinator Education Forum. So just interested to know how many people have attended. Yet to just we'll try and do searches as well. Mariam, thank you.
It's really good to see that.
Yeah, it's fantastic, isn't it? Yeah. Okay, that's interesting. So again, I think we just need some guidance in terms of how these forums are supporting you. I think there'll be opportunity later just to let us know kind of what topics it is that you'd like to see. So I've not attended any of these forums. Okay, that's fine. Is it perhaps you're new to the role? Okay. And again, what would you like to see covered in future forums? Thank you, Shelley. Is there anything in particular that you'd like covered? Thank you, Tejas. I appreciate you saying that. Searches, okay, and reporting, yeah. As I say, that was a very brief overview today, but certainly searches and reporting is something that we can definitely do. making own searches. I appreciate that, because obviously some of the times you have to manipulate the search, so that's fine. It was something that I'll discuss with the EMIS and see if they can come back to us. And audits as well. Okay, and how to set up a recall. Yes. And thank you for participating, and indeed we look forward to the next forum. So with respect to the next forum, Nisha, can you just
so
give us an overview of that?
Yeah, so the next forum is due to be held in November. We don't have a date yet because we did envisage to do a face-to-face forum in November, but I just really want to make the online forums successful before we have a face-to-face forum, because I don't want two people turning up to the face-to-face forum. So we're trying to just improve on our online presence before we have a face-to-face one. But we will be sending out information about a November date. We'll possibly do it online and then see if we can do something face-to-face in the new year. Yeah, as I said, they run monthly. It's every 2 months. And I know a lot of people haven't heard of these forums before, but please speak to your practice managers about them. They have been going on for a while, and appreciate that a lot of people come and go in general practice, so it's not easy to keep up to date with comms and offerings. But everything is on our website, as Sarah specified earlier as well. And I'll send out comms about the free Care Coordinator Conference in November. Thank you for joining today, guys, and hope to see you all again soon.
Thank you so much. Really appreciate you joining. Thank you.
Thank you.
Take care.
Bye.
Bye.